Computer. Good morning. Actually, almost afternoon right now. So today we have the ladies from Sinopol. Thank you, Anae. Thank you, Kristen, for joining us today. As part of World Fertility Day, like I mentioned, we are doing talks with reproductive specialists as well as leaders in reproduction and anything and everything related to infertility. Basically, we want to make sure that we are creating enough awareness and as well as giving you the tools that you need on your journey to through infertility. So, like I mentioned today, we are chatting to the ladies from Sinopol, and they are discussing Sinopol, PCOS, and how Sinopol can help you when dealing with PCOS. So, welcome, ladies, and thank you for joining.
Thanks to you.
It's a pleasure. Can you please introduce yourselves, where you're from, what it is that you do?
Sure. So let me start. My name is Kristen, and I'm the responsible pharmacist for GDC. So head up the Quality Regulatory Pharmacovigilance Department. And yes, we are responsible for Sinopol in South Africa.
Thank you, Kristen.
And I'm Anae Hovengas. So I am a project manager with a focus in new product development and just normal technical projects in a normal day. So yes, that is more or less where that fits in.
Thank you very much. Thanks, ladies. So we're going to jump straight into it. And we've got our first question is, what is PCOS?
Perfect. So let me take that one. So PCOS, or polycystic ovarian syndrome, is a hormonal disorder amongst women of reproductive age. So this is actually caused by multiple abnormal follicles in the ovaries. So this then in turn also causes hormonal imbalances and metabolic abnormalities. So hormonal imbalances are, for example, increases in LH or luteinizing hormones, which also then increases the testosterone levels in the body, and associated, obviously, the unwanted side effect, the hair growth, the hair loss as well. And then metabolic abnormalities is more the insulin resistance. And then all these hormonal imbalances and abnormalities in women with PCOS also then increases the risk of infertility, type 2 diabetes, and heart disease. So overall, this just actually affects your whole quality of life.
Yeah, absolutely. So if you ladies don't know, I do have PCOS. It's something that I struggled with for many years. So I'm always loving doing the talks on PCOS and understand everything. Our next question is, what does current research say about the efficiency of Sinopol in improving metabolic abnormalities, insulin resistance, and glucose metabolism, sensitivity, and menstrual regularities in women with PCOS? Sorry.
No, not at all. Listen, it's the same happens to me. So I think, listen, when we were chatting about where the efficacy comes into and what I want to point out in this conversation, I think we pride ourselves that Sinopol has got 13 proprietary clinical studies on Sinopol itself, with over 1,500 patients. So it's a long story. There's a lot of facts that I would like to highlight. First of all, like I say, we pride ourselves in that. Then, like Kristen mentioned, when there is an excess of the luteal hormone, that results in insulin resistance, and that causes further metabolic dysfunction, further hormonal imbalances. It's a vicious cycle. You have insulin resistance, the hormones are imbalanced. The hormones are imbalanced, you have insulin resistance. It's just a cycle, and everything influences each other. So Sinopol, you'll see in the logo we have, it actually says bring back the balance, and it touches on what I just explained. There's insulin resistance, hormonal factors. We want to bring back the balance. So Sinopol contains 3 ingredients. We'll touch on that, I think, a bit later. Myo-inositol alpha-lipoic acid, which is an antioxidant, and folic acid. But when the researchers that did the clinical studies, mind my lack of English, we grouped it into 4 further categories to explain the efficacy and what we are looking at to get to a point of how effective it is. So it was number 1, hormonal imbalances or balances, insulin resistance, then hyperandrogenism, so that is an excess of your male hormones in your body, and then oxidative stress. So the question I think we wanted to point out was specifically also on insulin resistance. So the combination in Sinopol specifically showed an improvement in metabolic factors, insulin response, and then hormonal balance. That was reiterated in all of the studies. It's been shown over and over, and I would love to show the extracts of the studies, all of it.
Yeah.
Then the alpha-lipoic acid has got a direct engagement in the insulin signaling pathway. It affects the insulin directly. We've also seen with Sinopol patients or PCOS patients with familial diabetes and with no gene in the family that has got an effect and a result, and relief is the wrong word, but has seen results in PCOS. Then in adolescent girls, we have seen 35% increase in insulin sensitivity or resistance, and postmenopausal women is 66.7% also improvement in the insulin resistance. So that touches on the first part. We are in insulin resistance. Then, like we said, and Kristen expand, that affects your hormones. Getting to the menstrual cycle, that was the second part of the question. So interestingly, the data shows that 90 to 95% of women who do not ovulate has got PCOS. And that shows you where this hormonal imbalance comes into. And again, like I say, when we have an insulin resistance issue, we have a hormonal issue. Then we have the androgens, like we said, hyperandrogenism, your male hormones. That obviously interferes with your female hormones and your cycles and affecting ovulation. Yeah. So again, we're speaking about the efficacy of Sinopol. So Sinopol, also the combination of myo-inositol and alpha-lipoic acid, show that regardless of the women's metabolic type, there was a positive effect on the menstrual regularity. Then also the combo showed that menstrual cycles were restored. And also improved the hormonal environment has improved in these females. And then we've seen a significant improvement in menstrual cycles from 2 to 5 cycles in 6 months. And that's really incredible. Yes. So, and I want to summarize the point again in bringing back the balance. Yeah. Hormones, insulin resistance, balancing that and getting to your menstrual cycle, ovulation, etc.
Thank you very much. We talk about what roles do lifestyle factors, diet, exercise, stress management play in conjunction with Sinopol when managing PCOS symptoms.
Yes, so I'm not sure if you're aware, but Sinopol is currently classified as a complementary medicine. So what complementary medicines actually mean is that the product contributes to your normal innate healing system. In other words, it just basically assists your body to stay healthy. So lifestyle factors are therefore very important. And it is important to adapt a healthy lifestyle always. We always hear the importance of a healthy lifestyle as well. And I'm sure we've all heard about free radicals and free radicals causing oxidative stress and the importance of antioxidants as contained in Sinopol as well. But free radicals can be caused by mental stress, infections, over-exercising as well, and that all causes oxidative stress. So everything is about a balance, like I just said, bring back the balance. And then interesting enough, there were studies that have shown that one major cause of spontaneous or threatened abortion is due to oxidative stress. Oh. So also we know weight gain makes the symptoms of PCOS worse as well. And then there's also data that have shown that a balanced diet, so for instance, eating lean proteins and low carbs, are beneficial to PCOS patients. Okay. Diet and exercise as well can also assist with recovering hormone levels. So basically, Sinopol just works synergistically with a healthy lifestyle.
Thank you very much. How can individuals assess whether Sinopol is a suitable option for their personal PCOS management plan?
So this one is actually interesting, and it baffles your mind when you hear that there's approximately 10 million women globally that are affected by PCOS. And then 80% of these women are actually not aware that these symptoms that they are experiencing is actually PCOS. Yeah. So ultimately, at the end of the day, it is also shown that PCOS presents itself in different stages of a woman's life. So you will look out for typical symptoms in your adolescent years: acne, irregular menses, hirsutism, which is more hair, unwanted hair, a moustache in other places as well. You can see it on the chest, etc. Then further to adult women, you will clearly experience infertility, pregnancy complications, and then even in your mature women, type 2 diabetes, hypertension. So I think these women, if you think about it, they experience these symptoms. You don't know what's going on in different stages of your life. At the end of the day, the recommendation is to go to the healthcare professional, to consult the healthcare professional to make a diagnosis. Further, I think we pride ourselves, like I said earlier, in the efficacy. And that's what we also want to focus on, why it is a suitable option. We have clinical trials on Sinopol, and the efficacy has been established. We can obviously not make any promises, as each patient is different, but that can be discussed with your healthcare professional.
Thank you very much. You mentioned, while you were talking, you mentioned about, these symptoms and things that will show you that you have PCOS. And the problem that I'm realizing a lot is that women don't know what PCOS is. And I'm always doing a talk on PCOS. And the reason I'm doing a talk on PCOS is because there are so many women. We have a talk today, but in a month or 2 months' time, you'll hear there's like a whole group of women that don't know they have PCOS, and they don't know they can be helped. And there's so many things that they're dealing with, but they don't know that there are so many women out there that has it. So thank you for bringing all of this across. Then we talk about what changes, the next question is, what changes in PCOS systems or overall health were observed by using Sinopol?
Yes, so I know I alluded to all the clinical studies that we've got. So I'm just going to give you some stats that we observed with Sinopol itself. So 45.5% reduction in insulin resistance. There was an 8.4% reduction in obesity, 40% reduction in testosterone levels, and then also a 16.4% reduction in hirsutism, or the unwanted hair growth. Then also, as Anna also previously mentioned, there was a significantly increased number of menstrual cycles, so it increased from 2 to 5 cycles over 6 months. And then also there was a 44% increase in fertility for women undergoing IVF. So just kind of increasing your chances, in IVF. So little additional help always needed.
That's very good stats. How does Sinopol compare to other common supplements used for managing PCOS?
So there are actually, numerous products on the market, and Sinopol really differentiates itself from the others with a very specific fast slow technology that we have in our product. So Sinopol contains 3 active ingredients. So as I mentioned earlier, alpha-lipoic acid, myo-inositol, and then folic acid. So with the focus specifically on alpha-lipoic acid, and we do not have a competitor in the market with this technology as it was patented, the fast slow technology in which the alpha-lipoic acid is encapsulated assists with the normal state or the half-life of alpha-lipoic acid. And let me just rephrase this. In general, without the fast slow technology, alpha-lipoic acid has got a very short half-life, so that means it's removed from the body very quickly. And you want that activity in your body for as long as possible. Kristen explained about the antioxidants and the oxidative stress and the impact. It impacts your healthy cells, etc., further functions. But we want to get optimal antioxidant activity out of the alpha-lipoic acid. So that's why we have the fast slow technology. And what that means is we effectively have a full 24-hour coverage in our small micro-encapsulated granules that we have in our product. For those who know, you would note that there's microgranules there. They do not dissolve. No. They are not supposed to dissolve. And that is part of the technology so that we can retain this activity of this antioxidant. The alpha-lipoic acid plays a critical role in antioxidant as a metabolic component, and then impacts enzymatic reactions and involvements in glucometabolism, also an anti-inflammatory. So that's the key focus, the alpha-lipoic acid. And then the way it was formulated in the synergistic balance with the myo-inositol. The myo-inositol we know helps with ovarian function, decreases hyperandrogenism, and the insulin resistance. It also has a positive effect on ovarian health and egg quality. So the synergy between the two is critical. And then folic acid, everyone knows if you want to feel pregnant, supplement with folic acid.
Yeah.
So we want to ensure that we prevent neurotube defects in the future. Folate deficiency also assists in the regulation of homocysteine levels in the body, an amino acid that can cause damage. As we know, we want to avoid any damage in the body. Usually when your homocysteine levels are high, they can pick up that you have a folic acid deficiency and then assisting with red blood formation. But we really want to differentiate ourselves in the technology that we have, the synergy between the ingredients, and then the studies that we have shown that this works.
Thank you very much. Our last question is, are there any potential side effects or interactions with other medications that users should be aware of when taking Sinopol?
Yes, so I mean, like we previously also said, unfortunately or fortunately, everyone is different and reacts differently to medication as well. So all medicines can essentially have side effects.
Yes.
It is always important to just then seek advice from your healthcare professional. Is it your doctor, your pharmacist? You obviously have a little bit more of your patient history as well. But the known side effects of Sinopol itself kind of mimics that of low blood sugar. So you might feel a little bit dizzy, headache, a little bit of sweating. Currently, there's no known interactions. And then also just a reminder, our current Sinopol sachets contain both sweetener and sugar. So if you're sensitive to any of the sugars or sweeteners, just ask your healthcare professionals for advice. But we are also happy to announce that we are busy with further developments in this category. So watch this space.
Thank you very much. You mentioned earlier about the little stuff that don't dissolve. I know all about it, but I put a little extra water in and I shake it about and drink it.
Yes.
Because you got to get the last bit out, eh?
You need the good stuff. You want to get the good stuff out.
You want to get the good stuff. So I just want to mention, PCOS is not something that you can, it can't be cured,
No.
It's not something that you can be cured. So even if you're not on the path of trying to conceive, yes, Sinopol does help you. It's going to help you when you're trying to conceive. But even when you're not trying to conceive, it is a something that you have to do for life. You have to do it for a long time. It's maintenance when it comes to PCOS. If you are suffering from PCOS, it's going to help you. So continue taking it. I understand people's going to say, oh, but I can't take it for many years. I can't take it for like 10 years, 20 years. But it does help. Even you're taking it for 6 months at a time or something, try and do it like a maintenance type thing. So thank you very much, ladies. I mean, I know all about Sinopol quite a bit. I mean, I've done it over the years because it's a product I really believe in. Like I said, I've taken it myself, and it's a good product. So thank you very much for joining us today and taking the time out to do this talk. Thank you, ladies.
Thanks for the opportunity.
It's a pleasure. If they want to purchase Sinopol, where can they purchase it from?
So currently it's in all major pharmacies. So your independent pharmacy should have that in stock, and then also in your Dis-Chems will have the stock. Otherwise, you're welcome just to pop us an email, info@golfdrug.co.za. We'll see what area, let us know what area you're looking in, and we will let you know, direct you to a store.
Thank you very much, ladies. Have a lovely day.
Thank you.
Bye.
Bye.